Can 2020 give us a break? The government of the Democratic Republic of the Congo has confirmed the deaths of 5 individuals who were infected with Ebola. Citing authorities in the Democratic Republic of Congo, the United Nations Children's Fund reports that a new Ebola outbreak has occurred in the country's city of Mbandaka. This is the 11th outbreak in the country since the virus's discovery in 1976. 9 individuals are reported to have been infected. 5 of them have died. The individuals died between the 18th and 30th of May, but were confirmed to be Ebola-related yesterday. The virus's incubation period lasts from 2 to 21 days. Symptoms of the Ebola virus include fever, headache, muscle pain, and fatigue. These symptoms are followed up by vomiting and diarrhea. Ebola is passed on by human-to-human transmission. Individuals can be infected if they come in contact with sweat, mucus, saliva, blood, or other body fluids of infected people. In the article, UNICEF states that it will send 36 staff members to help communities and organizations to manage the new outbreak and aid in raising awareness of the disease. As we said before, this is not the first time the Democratic Republic of Congo has dealt with the Ebola virus. Just 1 year ago, this was happening. Also, I don't know why my voice was so weird at the time, but
another epidemic. The latest Ebola outbreak in the Democratic Republic of Congo is expected to last until mid-2019. CNBC reports the outbreak in the North Kivu province has already killed more than 200 people. According to the CDC, Ebola commonly affects humans and non-human primates and is caused by an infection with a group of viruses within the genus Ebola virus. The disease spread extensively in the town of Beni in the North Kivu province because of the dense local population and also because of modern health centers which patients tend to visit even though they aren't regulated. These health centers reportedly didn't have running water for hand washing, and patients would reuse needles to inject medicine. According to NBC News, the WHO told reporters it would be at least another 6 months before they can declare the Ebola outbreak over. This is the 10th Ebola virus epidemic the Democratic Republic of Congo has faced since its first epidemic back in 1976.
If you're curious as to how the Ebola virus compares to the coronavirus, keep watching. A new statistical study shows that the Wuhan outbreak was doubling in size every week during the early phase of the contagion. Chinese researchers find that the novel coronavirus epidemic doubled in size every 7.4 days during the initial outbreak from December last year to early this month. The statistical study published in the New England Journal of Medicine suggests human-to-human transmission occurred early in the outbreak's beginning. Examining the first 425 confirmed cases of coronavirus infection, the scientists estimate that the mean incubation period was 5.2 days. Before January 1, 2020, 55% of the symptomatic cases were linked to the Wuhan wet market, but just 8.6% of the subsequent cases were connected to the market. The authors say that it is clear that human-to-human transmission is occurring and that the epidemic has been spreading in recent weeks. MedPage Today reports that the virus's reproductive number of 2.2 means a carrier will infect 2 people on average, which is more than Ebola. Citing Infectious Diseases Society of America, the outlet reports that the reproductive number is situational, and quarantining a patient could reduce the number to 0. For more news animations and explainers, hit the subscribe and bell button to join the TomoNews family. Thanks for watching.